Okay, and then I will start by bringing up my slides. Can you see slides, George? Does it look good?
They're really fine.
Yeah.
So good.
Okay. So what we will do in this webinar, so first we will start by just introducing ourselves, people here on the panel, and then we will start by giving you a short presentation about the MSc in Dental Public Health and what we are offering here at UCL. And then after the presentation, there will be time where you can ask us any questions that you might have, and we will be very happy to answer them. You can also put your questions in the chat if you prefer that. So shall we start by introducing ourselves? So my name is Anja Heilmann. I'm an associate professor in dental public health at UCL, and I'm one of the co-directors of this MSc Dental Public Health program. George, do you want to go next?
Hello, everyone. My name is George Tsakos. I'm a professor of dental public health at UCL, and together with Anja, the other co-director of the MSc in Dental Public Health program, and look forward to our discussion today. Upul.
Hello, everyone. I'm Upul Kure, and I'm a former student of this MSc Dental Public Health course at UCL. Currently, I work as an assistant professor at Tohoku University in Japan. Thank you.
And thank you very much, Upul, in particular, for joining us and for telling us about your experience, which will come later towards the end of this presentation. So, as I said, please keep posting your questions throughout. And with that, I will hand over to George, who is going to talk to us during the first part of this presentation.
Thank you very much, Anja. We have prepared a short presentation to give you an idea of who we are and what is on offer on the course. But of course, we very much welcome the discussion that will follow, and you tell us the questions you will have, and we'll try to address them. So who we are, you're meeting some of the UCL Dental Public Health group, but we're all very actively involved in the teaching. As a group, the Dental Public Health group at UCL is a very well-known internationally, nationally and internationally group for the research it does, for the teaching it does, but also for the policy and advocacy it does. Let me say that all three of us that are here, but everyone in the Dental Public Health group has been in the position you are now, has been actually further down the line, has been a student of the MSc in Dental Public Health at UCL at some point in their life. So who we are, we do an awful lot of sort of recognized research, and many of you probably know some of us, particularly the head of the group, Richard Warden. I will come to introduce us in all of us in a minute. We do research on a number of areas around dental public health. Particularly, I would say we are quite well known for our research in oral health inequalities, health promotion, outcomes, life course epidemiology, aging and oral health. And I will not say much about our research, but I will try to focus a little bit more on our teaching, because this is what you're mostly interested about. But also, I will say where we're based and what are the key sort of broader roles that we have, that our teaching and research allow us to play a broader role in influencing and hopefully working towards improving the oral health of the populations globally. So the first of these important highlights I would like to say about our group is that we are a WHO collaborating center for oral health inequalities and public health. The World Health Organization has collaborating centers across the academia in the world that works with them to provide input and to its policy. And you may well know that this is a very crucial time for oral health in general, because the WHO has recently put forward a global strategy for oral health, and even last year an action plan. So for the next 10 years, and this has been the global strategy has been adopted by all nations across the world. They realize why oral conditions are major public health problems, and something needs to be done about the neglect of oral health in populations globally. So it's a crucial period coming forward for oral health in general, and the World Health Organization is leading that effort. It works with collaborating centers, and in oral health there are only a few in the world, and we are very privileged to be one of those collaborating centers, particularly with a focus on oral health inequalities and public health, which very much plays to our strengths. The director is our group sort of lead, Professor Richard Bott, who you will meet during the year in the MSc an awful lot. So unlike what you may have experienced in your previous sort of studies, I'm saying this because this is what I had experienced in my previous studies when I was in your position many years back. Everyone is involved heavily in teaching, including the head of the group and all of us. But it's not just the WHO sort of affiliation that makes that group special, I think. It's also the fact that Richard is, and other people are involved, but a lot of past MSc Dental Public Health UCL colleagues are involved into you may have heard about the LANCET Commission on Oral Health. And the LANCET, which is the most sort of respected journal in medicine in the world, does commissions when there are issues that are important and neglected at the same time. And oral health, they realized a few years back that oral health is fitting that category. It's an important area we should focus on, but at the same time, it's politically neglected. Nothing really happens as it should have on a major public health problem like that. This was kickstarted from a series of papers called the Lancet Oral Health Series, where Richard was again instrumental in them. And now there's a commission that next year will come with recommendations about how oral health can be improved globally, and our group plays a key role in that. The two chairs of the Lancet Commission is Richard Watt, as I said, and also Carol Guarnizo Hereño, who is an academic in Colombia, but of course she did her PhD with us at UCL, and we work closely with her ever since. There are other bits and pieces of important advocacy, and I will refer to them later on in my presentation, but I wanted to highlight those two ones to say that you are coming to a department that is at the forefront in dental public health globally, and it's a crucial period for oral health globally, because outside the usual oral health people are interested and realize that something needs to happen in oral health with a public health emphasis. So this is a crucial period to be involved and motivate that change. If I can move now, because I'm thinking of the time, I don't want to waste a lot of your time on this. Where are we based? We are a dental public health group within an epidemiology and public health department, not in a dental school. We have strong, close links with the Eastman Dental Institute, which is a dental faculty, if you like, at UCL. But we belong, excuse me, in the epidemiology and public health department, research department of epidemiology and public health, headed by Professor Anne McMahon, that has a number of other groups exactly on that, on epidemiology and public health, in terms of life course epidemiology, in terms of inequalities, in terms of sort of work around Eastern Europe and comparison with Western Europe. So there are different groups. I'm not going to go to each one in detail. If you go on the website, you will find everything. There are other sister departments, if you like, that together they form the Institute of Epidemiology and Healthcare. That's a level up in the UCL hierarchy. So it's not just epidemiology and public health, it's primary care and population health, behavioral science and health, and applied health research. Those four departments, independent departments, are all part of the Institute of Epidemiology and Healthcare. And the Institute belongs to the broader Faculty of Population Health Sciences. So the group is rooted very much in the public health and population health stream of research at UCL. But as I said, there's also quite strong links with the dental side of things, so with the Eastman Dental Institute, which is part of the Faculty of Clinical Sciences, a different faculty, but we work across. So joining UCL, you join a wide community of research and teaching that covers important areas. And I think in particular, we're all dentists, but being based in a public health department has given us a much wider view of things and allows us to engage better with the wider public health agenda, take that oral health expertise we have and bring it to the wider public health agenda. So I think it's a marriage made in heaven, really, for us. But enough of that, let me move to the course you're interested in. So the MSc in Dental Public Health is exactly, and I'm not going to go into definitions, is what dental public health is about preventing oral diseases, promoting oral health, reducing inequalities, improving quality of life through interventions that refer to the population. We're looking at the wider population rather than specific interventions on one-on-one. That's public health. And you will get quite a lot of understanding about the conceptual, theoretical underpinnings, but also about ways you can practically sort of work towards preventing oral diseases, improving oral health, and reducing inequalities. So that's the broader scheme of things, I would say. That's the canvas, the background. Who are we? I've already mentioned Richard, who's the head of the group. He leads modules, he's actively involved in teaching. And he is, I would say, a really renowned figurehead in dental public health globally. Anya has introduced herself, and I've introduced myself, so I don't think we need to say much more unless you think differently, Anya. And there's another lecturer, clinical lecturer in dental public health that recently joined our group, and is Alex Blockland. And so the four of us will do an awful lot of the teaching, but we won't be the only ones that do the teaching. There will be a series of external speakers as well, and other colleagues, and I'll explain that. Anya will explain that in much more detail, because some of your modules are not just with the dental public health cohort, but across other cohorts as well. Interestingly, I was looking at the slides this morning. All four of us at different stages in our lives and times, reflecting also our ages and careers, have done the MSc in Dental Public Health, and then followed on to do a PhD in Dental Public Health at UCL. All four of us. A person I shouldn't definitely not forget to mention, because you will have an awful lot of information from and contact with, and who's actually excellent in a challenging period for administrative colleagues, is Tanya Harbinson. You may already have had some contact with her, or you will. She's our program administrator, and she will respond to queries that come on the email that you see on your screen now. So the dental public health at ucl.ac.uk. That's a crucial contact point, if you like. So that's us, that's our team. Why study with us? I've already covered that a bit by saying that it is a group that is in the forefront, not just of research and teaching, but also in policy and advocacy for better oral health globally. I refer to the WHO, I'm not going to say anything more. I refer to the LANCET Commission, I'm not going to say anything more about that. I just thought without slide that I cherry-picked two, but we work also very closely with the FDI, which is the World Dental Federation, has the acronym because of a French, Fédération Dentaire Internationale, rather than World Dental Federation. So our advocacy goes much further than, of course, we work closely with the Department of Health and Social Care in the UK, with a number of other sort of research collaborations across the world. But being able to advocate for policy and change, we're also involved in the Platform for Better Oral Health in Europe. Is a group that tries to take the theory and practice of dental public health and put it a level further and say, how can we make people's lives better? I explained why we are a research-intensive department and institute. And I think it's also the fact that teaching is so heavily a part of our life that is essential. So we apply ourselves to teaching. We enjoy teaching. We go to the classroom, and you will see us in all the time, really. And I think it's a different, when I first did it, and I still think so many years after, it's a different type of teaching than the one I was used to. It's a quite more sort of engaging, supportive, particularly the modules you will have as a dental public health cohort. I think some of them, there will be ones you will remember for life. I still remember some of them for life, but I'm not going to tell you which ones. So what can you expect from us? You will expect exactly what I mentioned before. I think what you should expect from us is to challenge you a little bit when you come to it, in a very positive way, in a way that says, try to take a questioning approach to things. Ask, why is this the case? Challenge, because that's the way new knowledge is provided. That's the way you start breaking barriers and go further in your understanding. And you do it in a sort of inclusive atmosphere, in a friendly environment. And you will be taught by all of us, as I said, but also with a number of external experts and other colleagues from other parts of the institute and the faculty that have expertise in the topics of interest and sort of in terms of statistics, research, etc., research methods, etc. We'll come to that in a minute. And I think it's also important, and I suspect Anya will talk about it more in a little while, that you will have pastoral care, you'll have a tutor assigned to you. It's not just academic, it's about you and your life in London for a year, trying to engage in a challenging, but also very, very, very sort of engaging and happy atmosphere in a friendly course. I think probably a couple of last things I want to say. There's almost two different areas in the course. One is about knowledge. Do I come to a course to get knowledge? You will get knowledge. I'm not going to tell you you won't. But you will get a lot of knowledge in terms of philosophy of public health and dental public health, principles of epidemiology, statistics, how they apply to dental public health. Sort of, these are basic and you get them early on, but also then knowledge in terms of stages of planning, evaluation of interventions, talking about dental healthcare systems, talking about evidence-based healthcare. You will get an awful lot of knowledge, but what you will get even more is how you're going to try to apply this in terms of practical and transferable skills, because you want to work in dental public health in the future career, but you need to have skills that are transferable. So you will get solid understanding about statistics, basic statistics, regression modeling. You will get solid understanding about research methodology. I referred to the challenging approach. It also has a structure into it. It's about how you critically appraise the literature. You will have communicational skills enhanced because of your writing, but also presenting, writing sort of memoranda for understanding for lay audiences or presentations for scientific audiences. And the highlight, what you will never forget, is the project you will have, which will take the summer out of you. But it will be challenging, but also very nice, because you will do an independent research project which we will decide together. We will not assign to you. We will decide together in order to make sure we match as much as possible your interests. So there's an awful lot for a year to come, and I think I'm trying to make it not more difficult by describing everything, because it sounds difficult when you describe it, but when you start to hear, it's like the bicycle. It's very difficult in the beginning, and once you start going, you go. And many others have done it before you and will do it after. So I think that's what I wanted to say. Should I? If I missed something, Anya, you add. please.
Thank you, George. Okay, so I will take over from here. And in that second part, I'm going to talk a bit more about the program itself and how it's structured and what you can expect in terms of the practicalities. So this is a module-based program, and you can do the program as a full-time student, which is what most people do, and then you would complete the program in 1 year. But the course can also be taken part-time over 2 years, or on a modular flexible basis where you study over 5 years. The program consists of 8 taught modules, which are all compulsory, and each of those is worth 15 credits. And then in addition, as George has just described, you will complete your dissertation. So that's your individual project. And that dissertation is worth 60 credits. So overall, you have 180 credits for the course as a whole. And the modules are taught at UCL over 3 terms. So from September to December, from January to March, and then again April to June. And in terms of the dissertation, the work on your project, on your dissertation, will start towards the end of term 1, when we start thinking together about a topic for each student. So that's a process that, as George already said, is guided by us, but you will then work on your projects throughout the year and over the summer. So the dissertations need to be submitted by the end of August. So in July and August, students are basically fully focused on their projects. So, and this is what the full year looks like. So these are all the modules. I'm not going to go into detail on these individual modules now, but you can find information about each of these if you follow the link there at the bottom of the screen. So that takes you to the UCL prospectus. And there is a list of these modules, and for each module you can click on it. It's a link, and then it provides you a full description of what the module is about. So now the way UCL is teaching, or the UCL's teaching model is basically back to what it was before the pandemic. So all teaching is back in person. So this is an in-person course. There may be some exceptions. For example, some external lecturers who are based elsewhere might give the occasional online lecture. And this is something that we really have learned to do well in the pandemic as well. So that's something that's useful. And for example, we have very good links with other universities, for example, University of Glasgow, and Professor David Conway, who is an expert in oral cancer, does sessions for us, and sometimes he has to do them online. So, but all teaching usually is in person. And there is each term, there are 3 days of in-person teaching every week. And the other days are meant for your self-directed study, for doing revision, for preparing for your exams and completing your assignments. UCL has guidance on coronavirus in particular and how to keep safe on campus. So this is the guidance that we follow, and there is a link there in case you would want to look at that for some further information. So as George has mentioned earlier, we have a personal tutoring system in place. So that means that each student will be assigned a personal tutor who is a member of staff from the DPH group. So your tutor will be part of the Dental Public Health group. And your tutor will meet with you on a regular basis throughout the year. And this is really about providing a space where you can talk about how you are getting on academically, but also if you have any concerns or anything that might happen in your personal life and it might affect your learning. And we will try to support you as best as we can. And if somebody needs additional support, we can also help you by guiding you and signposting the services and the support that is available at UCL. So this is really an important part of being a student at UCL. So another thing I thought might be useful is I wanted to talk a bit about career prospects for our graduates, because this is a question that comes up a lot. So obviously, your career prospects will depend on the country you will be working in and on your own preferences and on your own goals. But just to give you an overview of the different options. So one option is to use the MSc as a springboard for an academic career. So many of our past students have gone on to work in academia, so such as everyone who is on the panel today. And many of our past students have made an academic career for themselves that, for example, might start with a role as a research assistant. And we had several MSc students in the past who have subsequently started working in our department here at UCL and with our group. And we have several people currently working with us who have completed the MSc. Many of our students have gone on to study for a PhD. And indeed, again, many of our own PhD students who we have supervised over the years have completed the MSc course first. And as George already said, this is also the case for everyone here today. Many of our alumni really have become very successful senior academics and in lots of different countries all over the world. And another career path that many of our graduates follow is to work with governing bodies or healthcare organizations where they might be responsible for planning or organizing dental health services. So some of our former students are working for ministries of health in that country. And here in the UK, many are now consultants in dental public health. Some people have made very distinguished careers. So, for example, the current Chief Dental Officer of England, Sarah Hurley, is also one of our former students. It's also possible to combine clinical practice with research. So one of our former students is doing exactly that. So she is working part-time with us as a researcher, while at the same time also working clinically. So that might be an option also for people who don't want to give up clinical work entirely. Third sector organizations are another option. So especially if you are willing to look outside of oral health. So for example, recently we had a student from India who then went on to work for UNICEF on maternal and child health. And finally, there are also possibilities in the commercial sector. So companies like Colgate or Wrigley do also need people with data analysis skills and oral health backgrounds as well. So there are lots of options, and we are very happy to support our students as much as we can, for example, with identifying funding opportunities if you want to pursue an academic career, and by giving you advice and speaking to you about your plans and about your next steps. So another important opportunity I wanted to talk to you about is the Aubrey Shyam Scholarship. So some of you might have heard about Aubrey Shyam, but some of you might not. So just to explain who Aubrey was really one of the most influential figures in dental public health globally around the world. So he was someone who has inspired generations of dental public health professionals, including all of us here on the panel today. And it was Aubrey who established the Dental Public Health group at UCL in the 1980s, and who also established this master's course. And in honor of his legacy, 2 scholarships have been established. So one for home students with a value of £2,500, and one for overseas students with a value of approximately £5,000. And you can apply for one of these scholarships if you have received an unconditional offer for a full-time place. And the application process is actually very straightforward. So to apply, you need to submit a copy of your UCL offer, your CV, and a supporting statement. And you submit that to the dentalpublichealth@ucl.ac.uk address. And you can find more information again via the link shown at the bottom of the slide. So this year, the deadline for submissions is the end of June. And then after that, decisions are being made about the recipients. So have a look at that page. So if you click that link, that would take you here to the Corporation Scholarship page where all of this is explained. So this was all I wanted to say. So I would now like to hand over to Dr. Upul Kure, who is one of our former students. And Upul completed his master's with us in 2016. And he's going to tell you a bit about his experience and where it has taken him.
Thank you. Thank you, Anya. So hello again, everyone. So Anya and George explain about the strength and the prestige of the institution and the depth and the richness of the modules in the course. So I will briefly tell you about my experience when I go through this UCL's Dental Public Health Master's course. Let me introduce myself again. So I'm Upul Kure. I'm Sri Lankan, and I completed my PhD last September. I did my PhD in Japan. Currently, I work as an assistant professor in Tohoku University in Japan. And I've been living in Japan since 2018 with my family. And I'll tell you how UCL's master's course helped me to get here. So I got my basic dental degree from University of Peradeniya in Sri Lanka. Then I practiced clinical dentistry for about 5 years. For me, with time, clinical practice became a more like a mechanical skill, and I felt that it was not keeping me intellectually very active. So I took a rather bold decision to pursue dental public health. But at that time, I didn't have any clear idea about the specifics of dental public health, or I didn't have any experience regarding dental public health. I just knew the people in dental public health are different than clinicians. So, and partly my decision was influenced by one of the a great mentor of me. I respected so much. He was a dental public health professor in my university in Sri Lanka, and who happens to be alumni of UCL. So anyhow, I managed to enroll in the MSc course in 2015 as an absolute beginner to the subject. I didn't have any statistical background, or I didn't know anything about epidemiology, research methods, nothing. So, however, within first few days into the course, my perception of health and healthcare changed completely, mainly due to the style of teaching and the people who deliver these concepts. In the beginning, you learn overwhelmingly new, lots of new concepts in a very short period of time, but these concepts really broadens your thinking, and you start to feel kind of good about it, because you understand things differently, and because of the way the course is structured, when you learn new concepts and you are given some basic tools that are needed to understand and investigate these concepts deeply. So and I remember Anya saying in her first lecture that MSc is your first step towards becoming an independent researcher. I don't know whether Anya remembers that or not. So I must say that she was correct, and at the end of the MSc, I felt very confident and very comfortable with working on any given project. So thanks to the solid foundation and the basic tools I gained during this 1 year. So when I started my PhD, I saw some other students who are struggling mainly due to the lack of solid understanding of the core concepts. But thanks to these wonderful people at UCL, my PhD life was rather comfortable one, and I managed to publish my work within just 2 years into my PhD, and I managed to publish my work in Journal of Dental Research. And I had a lot of time to work on many other projects and contribute to 13 more publications during as a PhD student. So it helped me a lot to be where I am now. So I hope some of you would get the same experience that I got in this great institution, and you get to know these wonderful people in UCL. And I don't want to talk to you too much, so I'll be happy to share my experience with you. If you have more questions about my experience, I'd like to I'd be glad to help any of you. So you can contact me via email or any other way. I'm glad to help. So thank you very much, everyone, and hope you will have a great experience at UCL, hopefully. Thank you.
Thank you so much, Ubu. That was really kind and really a lovely kind of retelling of that journey that you've been on, and thank you very much. So I would say we are now at the end of our presentation, so we are very happy to take your questions. So just so you feel free. We are not that many people here in the call, so feel free to either unmute yourself and ask, or put your questions in the chat. Just to say, if you have questions you want to send to us via email, as we said before, please send them to the dentalpublichealth@ucl.ac.uk email address. And I will stop sharing now so that we can see each other. Okay. So we have questions in the chat. So first question, thank you so much for all the useful information. Is it common for graduates to enter the commercial sector? If so, what positions can one take up? I don't think it's that common. And I don't know, George, do you have experience of that?
No, I wouldn't have it. I expect it's not very common because there isn't such a big commercial sector related to oral health. There is, and actually with corporate responsibility changes in the last few years, I think people are looking for expertise in epidemiology, public health, and then public health methodological expertise. But I wouldn't have followed every one of our past graduates to see who is working in the commercial sector. It's difficult for me to answer that you know,
Yeah.
as I wouldn't know how many they are in academia.
Yeah.
Exactly.
Yeah.
So that would be more familiar for me.
Yeah. So I think we don't have lots of details on that, but there are these companies that will need people who know about research methods and who know about data analysis. So shall we go to the next question, which is from Diesta from Indonesia. So hello. So there's a question about the personal statement. You can upload a document, yes, so many people do that and upload a separate document, so that's totally fine. There is no word limit for that. So usually the uploaded statements, they are maybe up to 2 pages, 2 A4 pages, so that should be enough. And you were asking what we expect from that statement. I think what we would expect is to really tell us about why you want to study this course and what dental public health means to you. So that the statement should be about, you know, what motivates you to pursue this MSc. I think that is really what we want to know. George, would you have anything to add?
No, I think it's not about knowledge. It's not about making sure, you know, you have revised everything. It's about bringing your heart to it. Why do you want to do it? Once you're here, then you will get bombarded with knowledge and skills. So it's not, oh, I need to revise to do that question. It's a personal statement. It tells us how you feel about going into public health. What is it there that motivates you? Why you want to do it?
Another question is about the Aubrey-Shyam scholarship. So whether it's possible to combine that with other scholarships. So the Aubrey-Shyam scholarship is meant to go towards the funding for the fees for the MSc course fees. So if you had another scholarship that covers your fees, then you would probably not be considered for an Aubrey-Shyam scholarship. But if you had another scholarship that helps you, for example, with your maintenance, with your living costs, then I think that could be combined. So I think in any case, you should apply, and we will then consider everybody's circumstances. There is another question about apprenticeships or internships. I think the short answer is so UCL does provide internships, yes, but we as the Dental Public Health Group do not provide internships. So I think the answer for us is no, although there are some schemes, UCL-wide schemes for internships, but they are more for people who are just out of school, really, and who are thinking about whether university is something for them. So, but we as a group, we are not able to offer internships.
I think it would have been impossible if you think that you want to do an MSc if it's a full-time, which most people are. Not all, but most. It is a year. So spending a good 3-4 months out of this to do an internship would really jeopardize the chances of completing the MSc well. There can be opportunities for working with other organizations, but after, I would say the MSc, because I know where people start. The starting thoughts are, can I do this and that and this and that? Well, make sure you do this well, you do the MSc well. And you heard from Upal, you could hear from others, this opens doors in a way. So rather than you need to focus on that year, I think us telling you that we will arrange to go 3 months somewhere, it will really risk, even for the perfect student, it will really risk having an MSc within that 12-month period. But that's just my view.
Anya, can I add something to the first question actually about commercial sector? Because I think we might not see a lot of people in commercial sector because mostly our graduates are dental graduates. So they are mostly moving into academia or other government sector. But I must say, if someone is interested in commercial sector, the tools that we learn during the course, it's going to help you, because with those tools you are becoming a useful resource to any organization. So if you are interested in any other sector, I think you have a better chance with these tools you learn through this MSc course.
Thank you. So I think these were the questions in the chat. Does anyone have any other question that you would like to ask us? So if nothing comes to mind right now, so you have the UCL email address that you can always use to ask if you need help with your application, or if there's anything else that's not clear where you would like more information on. Yeah, just get in touch. We're very happy to help. And I think if there are no more questions, then we should probably end our session here. So I just would like to say thank you very much for joining us, for asking your questions. Special thanks to Upul. In Japan, it's evening now, so quite late in the evening. So thank you for making time for us and for talking about your experience. Yeah, thank you.
Thank
So
you.
Guys.
I will stop the recording and then end the session. Thank you very much for joining us. Thank you.
Okay.